PM 456. B is the Roman number for 5, so it helps you remember 4 is one below, one above, one below. So add 1, subtract 1. Does that make sense? Alright, so you get a score of 1, 2, 3, 4. You get a score of 1, 2, 3, 4, and 5. And the motor is 2, 3, 4, 5, and 6. Alright? What is eyes?
Alerts.
It's real easy. It's add food backwards. That's all it is. So if your eyes are, if they're alert, like they're not saying there's any issues, like they're tracking you and stuff like that, they're alert, it's a 4. Now if you have to get their attention, like hey, and they look at you, that's a 3. If they have to, if it's painful signal, it's a 2, and if they don't open them, it's a 1. Alright? Now, the only reason I go through all 4 scores on this one, because that's a familiar acronym that you're used to. Add food backwards.
Yeah.
On these, I don't give you the 1s or the 5 or the 6. Because if they're a 6 or a 5, if they're at the end, there's no deficit. If they're a 1, then there's none. Right? So this side's no verbal, and if it's 5, they're talking to you normally. A&O times 4. How are you going to remember 2, 3, and 4? What is a 2? Incomprehensible sound. Three is inappropriate word. 4 is confusion. Here's how you're going to use this to help remember it. Fuck, where am I? Now, it doesn't mean it has to be a curse word. An inappropriate word can be like, hey, what's your name, sir? And you go, ice cream. That's an appropriate answer, right? That would be a what? 3. A 3. If they moan to painful stimuli, moaning is an incomprehensible sound. So if they moan to painful stimuli, they're a 2 and a 2. Alright? And then confusion. They can't answer what are your normal questions?
No questions.
What's your name? Where you at? What city are we in? Who's the president? Believe it or not, they can be really altered. They always get the president one.
Yeah.
I've had dementia patients.
And it's always just like,
Yeah.
it's never, I was like, is people that are sick just not like whoever the president is?
We have dementia patients that can ask all 4 of the questions.
Now, if you got a patient that has dementia and they're in a what do you call it, memory care facility, you got to think about it. They might not get outside. So, hey, caregiver, that's probably somebody they know, right? Hey, what's their name? You know what I mean? Like, ask them questions that relate to them. So you have to read that room and read that judgment of like, hey, I got to ask them the right kind of questions.
Well, we get some that they know all the right answers because they've been asked it so many times. And so you have to like kind of trick them up on.
Now they should be able to get the president, but they might not know what month, what day of the week. You know what I mean? Day of the week may be a little easier because they probably have a schedule. But so just keep asking questions if you think they're altered. Keep asking questions something that they can answer, but they should be able to answer.
We usually mix it up. If we know like they're able to answer all the ANO questions, we'll mix it up and be like, well, what's this?
And short-term memory and long-term memory, 2 different areas of the brain. But they usually have pictures of family members up there. And usually the staff have heard those names a lot, or they see those people. And I go, who is that? There you go. Well, that's my daughter, Denise. And I look at her and I go, is that right? There you go, yeah.
Yeah, that's
Okay.
what we usually do.
All right, motor. Again, 1 is none, 6 is no deficit. All right? So, what's a 2?
Separate.
The cerebral, the cerebral posturing. And then 3 is what? The corticate. What's 4?
Extension from pain.
Withdrawal from pain. And then 5 would be
Localizing pain.
This is how you're gonna, your acronym. DDWL. Don't do white lines. So, if you're looking just for a basis to get you there, EVM 456, add poop backwards, ugh fuck where am I, don't do white lines. At least you have a basis to start with. Alright, now if you can't remember which goes first, decorticate or decerebrate, hey, everything like cheerleaders. Anybody here a cheerleader? Nobody? You're doing moves.
No, but I'm not a cheerleader.
Oh.
I did drill team.
Alright, well drill team, you do everything to a count, right?
Mhm.
So, in cheerleaders, they know their basic movements is this and this. You know, like they start out like this, go like that, maybe go like that, but they have that kind of back and forth, alright, when they're clapping. It's a very structured deal. My daughter's a cheerleader. Alright? So, what they do is, if you think about it, they always start with their count, their hands down by their side. That's the cerebral. And they come up to a clap. That's your 3. And then you withdraw from pain. You withdraw, you're pushing it back and you're going with your hands down. And then you localize your chest pain. That's the only way I've come up to help remember that.
I just always think of the order because 2 is going to be worse. You're going to be in a worse position than 3, and decerebrate if you're not able to protect like your major organs. I think of that being at the bottom,
I like
and
that.
then this to protect you, so you're somewhat kind of
Yeah.
protecting your.
But if you think about it, you can go here, 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 and then you localize your chest pain. But I like your theory, and I'll probably use it in the future, but I've not come up with a solid one for that other than DDWL. But that will at least get you started on filling that out. It could be one question, it's an easy question, point. I would say usually they're going to paint somebody in the 7 to 9 area, you know, like a questionable, because they've always said less than 8 innovate. You know, a diabetic hypoglycemic could be a 3, or minimally innovative. But usually they paint somebody in that questionable category, like 7 to 9. So the default answer would be, for me, would be 7. But I can figure it out doing that. But again, it's a video you can watch at onprep.com, free preview. And if it's something you want to watch on it, it's exactly the way I just did it. Alright. APGAR. APGAR is not a 3 to 15. What is APGAR?
10.
0 to 10.
What?
So, you got 0, 1, and your 2s. And what are your 5? What does APGAR stand for?
Appearance.
Alert.
Appearance,
Oh.
Pulse.
pulse,
Grimace.
activity, respiration. Alright. So 0 means none, right? Alright, which blue works? Alright, so appearance. They're either blue or pink or blue and pink. So which one's blue? Zero. Pulse. What's a zero? Where do we start CPR at?
Less than 60.
And we do CPR. Grimace. Here's my deal. I've taken so many of these questions. I look for 5 descriptions every time. On that test, I've only gotten 4. Here's your way. If you get grimace or activity, I will tell you, usually it'll be the same description, but you have to times it times 2. Here's the usual description we get for a 0. Limp. And then respirations, none. Those are your zeros. You just have to remember, if you get 4, there are going to be similar descriptions if you get 5. But if you get 4, it's good. You got to times it times 2. Alright? Now your 2s. They're going to be pink. Heart rate's going to be greater than 100. Your grimace and activity deal will be flailing, which means moving arms and legs. And your respirations will be a strong cry. Alright. Your 1. Now, this is the way I like to do it. This is a blue, limp, non-breathing, dead baby. This is a full, functioning, healthy baby. Right? If I put those up there, I remember the 0s and 2s. I can fill out the 1 just by off that description. It's somewhere in between, right? Some people like to remember the 1s and fill out the 0s and 2s. I remember those and fill out the 1s. If you like this better, learn the 1s, you can figure out the 2s. Because, again, blue and pink. So, what's in between? And pink core, right?
Yeah.
Or just blue and pink. 0 to 60, greater than 100. What's in between there?
60 to 100.
You just need to remember to do what?
Ventilation.
There you go. Limp and flailing. Your in-between description is some flexion. None and strong cry. Your in-between is a weak cry. I do these and I fill out this. In the beginning when I didn't know it that well, some students like to remember this and they can fill out those. Whatever your mode is, it's one question. Just remember, we do it at 1 in 5 minutes. We trend to see the baby. Our goal is to see the baby improve. It may be a 6. The next one we want to see a 9 or a 10. Alright. We're going to do burns down here. But I'm going to go ahead and give you the burn, the rule of 9s. That's another little formula you may or may not get. Alright? So if you're looking at an adult on the rule of 9, so the Palmer method, do I need to explain that? Patient's palm equals how much? 1%. So if they say Palmer method, patient's palm equals 1%. Rule of 9s, you got 2 categories. You got adult and you got PD. Both have to equal how much? 100%, right? So always check your math. So you have the head for the adult. You have the torso. You got the arms. You got the legs. So what's the head worth?
18.
9%. What are the arms worth?
9.
No.
What is the front torso worth?
18.
And what is the back torso worth?
18.
That's your anterior, posterior. And then, what's your crotch worth?
1.
1%. What are your legs worth? 18%.
So is that,
So if you add it up, 18 plus 18 is 36, right? So I got two 18s there. 36 plus 36 is what?
72?
And then 73. 9 times 3 is 27. 73 plus 27 is 100. Always just make sure your numbers add up. Here's my easy way to remember this. To me, this always looked like a house. Your door is the crotch, it's 1%. Each corner gets an 18%. So our 18s is in the 18s is down here. Everything up here is 9s. So to me, it just always kind of looked like a house. Now, your other big deal on calculating one, when you get a calculation for a burn percentage, please slow down. Pay attention for the description, and every time they give you a description, calculate it. So, here's your big deal. On my arm, this is 9%. Give me two ways that this is divided into two. Anterior, posterior. So if they say anterior right arm, it's not 9%, it's what?
4.5.
All right, where's the other halfway point? The elbow, the joint. So if I say circumferential from the elbow down, that's 4.5. You know what I mean? So every time they give you a description, stop, calculate it right down. So the joint, that's your halfway point, anterior, posterior. Trunk. Anterior trunk means abdomen and chest. So that's your full 18. If it says chest, then that's 9. Abdomen is 9. Posterior trunk is 18. Usually they'll describe the posterior trunk as right and left, because you can divide it by the spine. So right and left is kind of the midpoint. Usually if they give you the posterior trunk, it'll be the whole deal. Okay? Crotch is 1. Legs. Anterior, posterior, just like the arm. And then your hinge, your knee, your joint, that's your halfway point. But if they say circumferential from the knee down, that's 9%. If they say anterior right leg, that's 9%. So just pay attention to the description. Because most likely if you miscalculate, that number will still be one of the answers. So just take your time, calculate it twice, and if you get the same answer each time, and it's there, just stick it. Now, a kid still has to get up to 100%. How we're going to remember this? Our kid is a 2-year-old. The reason why I say he's a 2-year-old is because the head is twice as big. The head and legs are the only thing that change in this. So you're still 18, 9, 9, and you're still 1. Now, how much did we add to the head?
9.
We doubled it, right? We added 9. So we still got to get to our 100%.
Yeah.
Head and legs. So whatever I add to the head, I have to take away from the legs evenly. So I have to take away 4.5 away from each leg. So each leg over here was 18. What's 18 minus 4.5?
13.5.
There you go. Head and legs is the only differential. It's a 2-year-old, so the head's two times bigger than whatever you add to the head, take away from the legs, evenly. And again, pay attention to your calculations. The other thing that goes with burns is, for paramedics, you're going to get asked this. The Parkland formula. What does the Parkland formula have to do with it?
How much fluid you do?
It's the fluid resuscitation calculation for within the first 24 hours. So, you do BSA percentage times weight in kilograms times 4 milliliters. And that equals the total amount of fluid the first 24 hours.
What is that, BSA, or, yeah?
BSA is body surface area. How much burned?
Oh, percent.
Burn surface area. Sorry, burn surface area.
Didn't you have?
Now, you give half in the first 8 hours. So pay attention to what they're asking for. If they're asking for, either way you're going to have to do this calculation. If they say how much fluid is going to be given in the first 24 hours, it's here. If they say the first 8 hours, it's half this. Now, to give you an example, we give you one to calculate. You got 30% burn, a patient with 30% burns. It is a 250-pound patient, so use your calculator. So you don't do 30% of it, you just do 30. So whatever percentage it gives you, just take that as a whole number. So what's 250 divided by 2.2? 113.6 times 30 is what? You're looking for a big number.
3,409.
Times that times 4.
13,636.
What is it?
13,636.
That sounds like a lot. And you might be like, that's a big number. That's, if you think about it, this is in milliliters. Think of 1,000 bags of fluid. This is 13 and a little more than half big bags of fluid. There's a lot of fluid resuscitation that goes on in the first 24 hours. Alright? So, if that, what's that divided by 2?
6,818.
First 8 hours, they're getting almost 7 bags of fluid. 7 big bags of fluid.
So we're working off of 30% of the body's fluid?
Yeah, that's our example. 30% burns.
So is it just gonna ask us the 24 for the
It
first
will
8
be
hours?
specific. It'll say first 24 hours or first 8 hours.
It's not gonna ask us like 1 hour, right?
No. You should feel safe in that like if you get a burn patient, severe burn patient, just open up 2 bags and get it going. You know what I mean? You're not going to overload them. Everybody good with the Parkland burn formula?
Nope.
Rule of nines? Alright. We'll start at the beginning. Usually they open up with like an easy trauma question. Like it might be a predictive injury pattern. It says, hey, you run on a motorcycle wreck and he went over, he hit a parked vehicle head on. And it said, where would you expect the injuries to be?
Chest and head.
Femur fractures. Why? Hits the handlebars. So that's an easy one. I've had that one start off my test twice. Alright? So that might be a predictive deal. Again, Waddell's triad. What did I tell you that one's for? It's a pediatric getting hit by a car, and it's a predictive injury pattern. Triad. Remember, trunk, head. Everything above the knee. But it's going to be femur fractures, Could be chest wall or abdominal injuries and head injury. Alright, you alright?
I almost dropped my pen.
Oh, you reacted there. Alright, here's another, you did Waddles. Kinetic energy. Do you know the formula for kinetic energy? It's the old school one, but they asked it now.
Mass times velocity?
Mass times velocity, I think it's mass times velocity squared. So they'll give you a scenario, or they'll say which one produces the most kinetic energy. And it'll have an 18-wheeler at 40 miles an hour and blah, blah, blah. I don't care how big the vehicle is. I care about how fast it's going. Because you square the velocity number. So if you got a Mazda Miata going 90 miles an hour, I don't care how much it weighs, it's going to produce the most kinetic energy over an 18-wheeler Rex at 40 miles an hour. Because you do 40 squared and you do 90 squared, those are really different numbers.
Yeah.
It's whatever thing is going the fastest. If you want to easy remember it, just say, hey, whatever's going the fastest produces the most kinetic energy because you squared that number.
Huh.
Does that make sense? Alright, trauma triad of death. Do you know the trauma triad of death?
Which one?
Nothing? Top of your head? Trauma patients.
Cause
Hey, what's the temperature like in a trauma room at a hospital?
Warm.
So what do you think one of the trauma triads of death is?
Temperature.
Hypothermia. Because what happens in hypothermia?
lose the ability to stay warm.
They lose the ability to stay warm, but they lose the ability to clot. They bleed easier. So that's why it's important to get them covered, get them out of the environment, especially if they're bleeding, get them somewhere warm.
Didn't they add hyperkalemia to it?
Do what?
Is it?
It's acidosis.
Acidosis.
So the second one is acidosis. As you become more acidotic, you're also more hyperkalemic. The other one, the third one, is coagulopathy. Your ability to clot. What's the one drug that we give to help with that?
TXA.
So, think of your trauma treatment. And I can just give you an example of what's on our end. Of course we give blood now, but we haven't given it yet. But we carry fluid warmers. And we carry 2 things of lactated ringers and 1 thing of normal saline in our fluid warmers. Alright? If they ask you for trauma resuscitation, fluid resuscitation, and it's not blood, then your number 1 is lactated ringers. But we carry fluid warmers, little pouches that carry the bags and it's plugged in. Carry fluid warmers because we want to prevent heat loss, right? And hypothermia. So, fluid warmers, hypothermia, keep the ambulance hot. Give TXA to assist with coagulopathy to help them clot. I mean, we give like 2 grams. Some places give 3 grams. I know part of our SWAT medic deal is they'll hit them with a shot of TXA in each shoulder and then give them another TXA whenever they'll start an IV. Part of our deal with our blood is we give them TXA and calcium. Calcium is more for the blood stuff because they get hypocalcemia when you give blood. But the other deal is the colder the trauma triad is, they get acidotic quick. So if they get acidotic, that's also hyperkalemia. So try to prevent acidosis, keep them warm, and give them TXA to help with the clotting, coagulopathy. All right. Occlusive torso is not a term, it just reminds me to drop this. Alright. So I've told you, anything with exposed bowel, evisceration, anything like that, or if they have a, female pregnancy, prolapse uterus. You cover it with what?
Moist sterile dressing.
Moist sterile dressing. So, anything in this abdominal care, in this area, is probably moist sterile. But you also do an occlusive dressing. I will tell you, if you have a full evisceration, you do the wound, like, there's no, like, free bleeding, you do wound packing and stuff like that. A great one is the, have you ever seen the multi-trauma dressing, the big one? It's about the size of a sheet of paper. So it is a,
Kind of like a pure wig, like not a pure wig, it soaks up, doesn't it?
yeah, but what's the word I'm looking for? So I did abdominal pads on this one guy, had abdominal evisceration, and but I wanted to see if it was going to bleed because there wasn't a lot of blood. And oh, it's a sterile trauma dressing, so it means it's sterile on the inside. So what you can do is, and it's usually has a clear packaging on the outside. I can cover it and take that down. And that way I have a view of it to see if it starts bleeding or something like that. But I put an occlusive dressing on there. So it's just a, but all these have occlusive dressings. Everything we're going to do here, it's just some of them have different forms of it. So moist sterile to cover it, any bowels, and then what? So what I did was soak the forearm, the abdominal pad, placed it over, and then I placed the occlusive dressing over it. Now, chest wall.
Chest.
Occlusive. You can say either say three-sided or vented chest seal. This is for our open pneumothorax. It's the same thing posterior, right? Especially with the open, that means they got pierced through there, pierced through the chest wall, usually a bullet or something like that. Always check the posterior. That's why they carry chest seals in 2-packs. So you just go boom, boom. Chest seals work great for occlusive dressings. But if it's vented, usually means we don't have to go rechecking for, it's like a three-sided. It has a little, have you ever opened one of those and put it on? It has like a raised area for air to escape. So that's your vented part.
Ours are weird. We have new ones and they're weird. They're all 4 sides and then it looks like, have you ever seen one of those like pimple patches?
Yeah.
Kind of looks like one of those in the middle where the, I don't know what they're called.
The release valve?
What color is the packaging?
It's white and red,
How big is the packaging?
like maybe this.
About like that?
Yeah.
So it's a,
They're new, like they just brought them out.
yeah, but our guys, our SWAT medics don't like them. I like them for packaging, but they like the ones that are the green ones.
Mhm.
Can't
Yep.
remember
We have one that's green, but the new ones are these white and red.
Yeah, they don't like those. They like the other ones better, but I like it because it packs into their. They gotta carry a lot of shit.
Yeah, because we had to use one the other day, and my partner was telling the doctors, like, if you see blood or something with a chest seal on the back, like, that's why.
Yeah.
I mean, you got stabbed, but, you know.
Anything up here is chest seal or three-sided occlusive dressing. All right. Anything up here is just an occlusive dressing. Anything in the neck. Usually they'll give you like a fork wound or a knife wound to the neck, and it's whatever. You might have to pack it a little, but you do an occlusive dressing. Why do you want to do an occlusive dressing in the neck?
Pressure on
Keep
the...
it sealed.
Has nothing to do with pressure. It has to do with So what you don't want, if your jugular vein is cut, or your carotid is cut, you don't want an air embolism. So if air gets in there and forms an embolism, you could have a stroke, or if it's jugular vein, you could have a PE.
There's a nurse out in Tyler in the cardiology, cardio ICU that was giving people air embolisms. They call them like the angle of death because he had like a lot of people.
This is not doing good procedures.
Well, I think he just got burned out. It was like, these people are going to die anyway, so I'm just going to help them.
Yeah. But anything up here is just straight running occlusive dressing. Here's three-sided Here, static moist sterile, but then plus occlusive dressing. All right. The old impaled object. All right. Impaled, let's say you have an impaled object in the eye. How do you take care of that?
Cover both eyes.
Cover both eyes, sympathetic movement, blah, blah, blah. So, impaled in the eyes, cover both eyes. Put the dress around. Now, the other impaled object deal they'll ask you is, when can you remove it?
CPR.
And or airway.
Alright, so you have to pay attention to description. Now, just because, let's say I had one of these pins going through my cheek, does that mean you have to remove it? No. So, if there's profuse bleeding going into the airway, pull it. If it prevents me from doing, the real way is to say it is, if it prevents me from doing airway management, effective airway management. So if I need to put, if I have one through and through, and I need to put in an OPA or brief for somebody, or get a tube and it's blocking, yank it. So if it prevents you from doing a procedure, or if there's profuse bleeding, that's when you can remove it. But if it says no bleeding, stabilize it and keep it there. It's not causing an issue. Now if you're gonna have to tube them, and it's in the way, you're like, it's not bleeding, but we're gonna have to tube this guy because he's got a lot of trauma, then go ahead and take care of that first. Now the other one, it says it prevents chest compressions. The way you need to remember that, they have to be dead for you to pull it out. It needs to be in the back or in the chest. Because I have to lay them on the back, right? So I can't do chest compression on somebody laying on their side. So if it's impaled in their back and they're dead, I can remove it. If it's impaled in their chest and dead, I can remove it. But they have to be dead. You can't play the what if game. Remember seeing did you ever see a funny reel? It's some TV show called Sirens or something. These ambulance workers, these three guys riding around the ambulance or whatever.
Oh, yeah.
And the guy gets a rebar,
Yeah.
all the deal. You ever seen that video?
Jimmy?
And he's sitting there talking to him.
No.
He called 911 for the guy passed out on the
Yeah.
ground. And he goes, and he's like sitting there with the rebar coming through. Now, if he was dead, yeah, you pull it out because it's going through his back, right? But if he's just sitting there talking to you or whatever, or he's stable, until the point he goes into cardiac arrest, you can minimize it for transport, which means you can have a specialty team come in, clip it, and shorten it as long as it doesn't affect it. But you can shorten it for transport, but you cannot remove it until they die. Because that might be the only thing keeping them alive. It might be plugging an artery or something like that. All right, amputated part. I'm going to give you the gold standard. The gold standard for an amputated part. We talked about this on the first day. We were talking about coolers and ice carrying out of it. The gold standard is wrapped in gauze in a bag on ice.
Is it a paper bag?
It needs to be wrapped in a plastic bag. So, wrapped in gauze in a plastic bag on ice. That's the best you can do. The concepts that have to be obeyed are, it needs to be dry and cold. Now, if they give you 3 things or 4 options in the gold standards out there, you need to figure out which one of those 4 obeys the 2 concepts, dry and cold, to the best of the best it can. So if it says in a bag on ice, it's dry and it's cold. If that's the best available answer, you choose it. Now, if it says wrapped in gauze in cold water, no, because it's getting wet. The concepts are dry and cold, and then the way I told you is the gold standard. All right, fluid resuscitation. If they're bleeding, less than 90 is your, if they're if they're hemorrhaging and they're less than 90, you can do fluid resuscitation. And it is 20 cc's per kilogram, or 20 milliliters per kilogram. The only time it changes is in neonate, 0 to 1 month.
Like 10.
What is the formula? 20?
20 cc's per kilogram. Everybody except neonates. Neonates is 10 cc's per kilogram. And remember, on kids, how would they give you blood pressure less than 90? What's the way I told you they're going to? Cap refill greater than 2. Bleeding and cap refill greater than 2, 20 cc's per kilogram. Remember to convert it to kilograms because they're going to give you a pound pressure. Now, that's for bleeding. 90 is the cutoff. You get them up to 90 or radial pulse is present. Fluid loss, we don't care about blood pressure. If you have known fluid loss or dehydration, give them the 20 cc's per kilogram. We don't care if the blood pressure is 130 over 80. If you have nausea, vomit, diarrhea times 3 days, yeah, replace that volume. Give them some volume.
Because can't your blood pressure rise if you're dehydrated because of the vasoconstriction?
It can rise. It can be high, but you know that once you start giving them fluid, it'll actually settle out, like kind of balance out. But yeah, give them fluid for dehydration, heat emergency, or heat exhaustion. Give them fluid resuscitation. I don't care what the pressure is. Give them fluid resuscitation. Now, hypothermia. I know we'll talk about cold here in a minute. If they're mild, it's okay to give oral rehydration. You know, they always say nothing by mouth. We've all been mild hypothermic before. Whether we're at a football game, we're out hunting, we're out in the cold for a long period of time, we get a little mild hypothermia. What do? Drink warm fluid. Tea, coffee, you know, something warm. It warms you up from the inside. But, no. That'll not make you warm. Not make you feel better. Or not notice the cold as much. But yeah, if they have nausea, vomiting, diarrhea, or fluid loss, or something like that, don't worry about the pressure. Just give them the 10 cc's per kilogram fluid replacement. Alright. I put these 4 up there because we already did flail, tension pneumo, all that other stuff. How would you know the signs and symptoms like if it was a pulmonary contusion? Just a bruised lung. Come on.
Nothing but,
No. So, coughing up blood. How do you say that? Emesis is throwing up blood. It's GI system. Hemoptysis. Hemoptysis. Now, you can get hemoptysis from TB, but guess what? TB is like an infectious deal. Do you get a bruised lung, just a spontaneous bruised lung?
yes.
No. So this is going to be a trauma involved. If you take a blow to the chest, and you'll get pain during inspiration and hemoptysis, that would be a pulmonary contusion. How would you figure out, I didn't put this one up there, how would you figure out if it's a cardiac contusion, a bruised heart?
You listen
Don't
to
think to the extremes.
Listen to heart sounds?
What's something visual I can see?
JUD.
You're thinking extreme.
Blood pressure.
What do we put people on to look at their heart?
EKG.
What would you expect to see in the EKG? How would you know the heart's
Ischemia?
pissed off?
It's fast. Tachycardia.
Say it again. The other part.
Tachycardia.
Who said PVCs? PVCs. Man, your lips never move, so I don't know. Alright, it's like you're like a puppet, the guy behind the puppet. Alright, yeah. So if you had somebody with a cardiac contusion, you would probably expect to see premature beats, but one of the big ones to let you know the heart's pissed off is PVCs. Remember, the heart's pissed off, PVCs. The brain's pissed off, seizure. You know what I mean? There's a lot of different ways your body can let you know that it's pissed off. That's our deal. Alright? But it's cardiac contusion, you'd be looking for like PVCs. You put them on EKG, do a 12 lead, and make sure it's like that. Alright, traumatic asphyxia. Do you know what that is?
Choking yourself?
Yeah. So, easiest way to think about this is hanging. So with traumatic asphyxia, you'll get a line of demarcation. You know what that means? So lack of return blood flow, if you're hanging, everything above that line will be purple. So everything above that line of demarcation will be purple. You can have busted blood vessels in the eyes. But just picture what you would look like if you've seen a hanging or what you see a hanging. It's going to be, or if you had somebody pinned for a long period of time, everything above is going to be purple. By the way, if you run a CPR and you notice there's some discolorization, purple and above, that does not mean they had a PE. Our guys say it all the time. It's like, and their doctor's like, I'm tired of hearing people say that's a PE. It's not a PE. It doesn't mean it's a PE. But your line of demarcation, busted blood vessels, purple from wherever that line of demarcation is. And the easiest way for me to think about it is a hanging. Alright, this is a long word that means something very simple. Tracheobronchial disruption. Alright, so we've gone over tension pneumo, right? We've gone through flail chest. I want you to think about it. Everything in our airway is an enclosed system, right? So if we didn't go over this sign or symptom for like a popped lung or a tension pneumo, what is it called when air gets underneath the muscle? Subcutaneous emphysema, like the Rice Krispies. So it's a closed container. So anything that opens that container, we could get the subcutaneous emphysema. You can get that with the tension pneumo. It just feels weird. Like you press on, it's like almost like bubble wrap, but it's not that hard to pop. You just feel it's like okay. It looks kind of swell. You see swelling and stuff like that. It's getting underneath. It's air getting underneath the muscle. All right. Tracheobronchial disruption. All it is, it's a lacerated trachea or a lacerated bronchus. So what is happening to the air? It's getting outside that enclosed system. So if you get swelling in the neck and you get that subcutaneous emphysema, you got a lacerated trachea. But on this test, they're going to call it a tracheobronchial disruption. I would just call it a tracheal laceration. They're going to call it a tracheobronchial disruption. Subcutaneous emphysema, no trauma to that area, to the neck. Usually it'll be the neck. Expect to see that. Like subcutaneous emphysema, took major trauma to the front of the anterior neck. You're going to do damage to the airway. The only time I've ever noticed a tracheal laceration, we didn't notice the swelling initially. Dude hit a spear something head on, one of those collapsible deals, like, you know, that separates the exit ramp from the service road. I can't, it's like a Montana something, it's named something. But it goes king, 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 king to absorb the blow. Guy speared it, car caught on fire, cop pulled him out. It was right by our station, the Texas Roadhouse parking lot. We get him back in the ambulance. He's unresponsive. We were in there and we're like, I think he still had good breath sounds initially. We go to tube him and he's doing the bougie, doing the bougie, and he's doing the bougie and everything. He's like, I can see him go past the cords. He's using that video deal. I can see him go past the cords. But he couldn't advance. I was like, twist it in your fingers, whatever, roll it, and then all of a sudden, I said, here, let me see it. And I just started manipulating it, and I met the least resistance, and I went forward, and it went, what? And it popped out here, and I was like, oh, he's got lacerated trachea. I go, that's bad. Hospital's in our district, too. So, let's go. And he had a lacerated trachea. He had ended up with a tamponade, and I think he had a liver lac or something like that. Anyhow, the dude ends up, I'm up at admin 3 months later. It was like the month before I promoted, or the month before I got moved. And this dude comes up there looking for somebody, and I was like, who are you looking for? He said, man, these guys ran on me. I ended up going to MCP. Here's where I had the wreck. Cop pulled me out of the car. And I go, were you driving a red Chevy flatbed? Or a red Chevy, like square body? And he goes, yeah. And I was like, yeah, I was on that. And I go, fuck, man, you already out of the hospital? And he's like, yeah, we thought dude was going to die, you know? And they did a pericardiocentesis on him in the hospital, all this major trauma stuff. And I was like, yeah, I didn't think you were going to make it. And he walks out of MCP 3 months later. But
What is it?
but if you get a lacerated trachea, it's tracheobronchial disruption.
What is it whenever there's an air bubble outside the lung and in between like the lung and the ribs? It starts with a P. It's supposed to hurt real bad.
Pneumostinum, media pneumostinum. Media.
The lungs are both still like
Yeah.
good. It's just
I think mediastinum. All right, next one, real easy. Diaphragmatic rupture has a key sign or symptom they're going to have to get you. What separates the abdominal from the chest wall? If you have a perforated diaphragm or a diaphragmatic rupture, you hear bowel sounds in the chest. Because there's nothing to separate, so you will listen to breath sounds and you'll hear they'll say bowel sounds on the chest. It's a diaphragmatic rupture. They have to give you that sign or symptom. All right. Hot versus cold on emergencies. I'm gonna make your cold ones real easy. So what are your different variations of hypothermia?
shivering, then not shivering.
You take my answers.
Mild.
Mild, medium, or mild, moderate, and severe. Mild, shivering. This is hypothermia. So mild hypothermia, they're still shivering. I'm not going to give you a temperature. If you're still able to shiver, you are in mild hypothermia. Moderate, they stop shivering. And severe is altered mental status. The temperature deals are too hard to remember. And it affects everybody different. I could say 92 degrees, your 92, core temp is 92 degrees and you're still shivering. And if you are, you're mild hypothermia. But you may respond to, I could be altered mental status at night. You know, that would be considered severe. What is your hypothermic ones? Exhaustion. You have cramps, heat cramps, heat exhaustion, and heat stroke. Cramps is easy. It's in the name. If you're cramping, it's heat cramps. Heat exhaustion. You're still sweating. It will look, your vital signs will probably look like hypovolemic shock. Low blood pressure, high heart rate, high respiratory rate. Might have an elevated temperature a little bit, but you're still sweating. You're able to get off gas some of the heat.
You said low blood pressure?
Yeah. Just like hypovolemic shock on the pattern, the chart pattern that we did. And heat stroke, altered mental status. Usually it's greater than 104, 105 core temp. And of course, altered mental status.
And that would be like a not sweating anymore either, right?
Right.
I stopped sweating. All right, on the book, on the test, yes, stop sweating.
Okay.
They give you that, it's heat stroke. If they say altered mental status, it's heat stroke. Now, they're going to give you the high temp. But in real life, of dealing with heat strokes, we The big deal is, you're not gonna know that because what would they do right until they stop sweating? They're gonna be soaked because they were sweating right until they stopped sweating.
So like last week, I ran on someone that it came out as a stroke because he had previous strokes.
Yeah.
So the questionnaire, the dispatch put it as a stroke. And he's a welder, and I didn't know that how hot I guess it gets like in the area that they work
on what
in,
area
or
they're welding in.
or how hot it can get. And he like had a stain on his shirt, but he was dry, and his skin was like almost as red as like color red, like he was just tomato, and
Yeah.
then his eyes were also red. He was altered, but his blood pressure was high, and by the time we got him in the back, threw like 2 lines in him, gave him some fluid or whatever, because I was suspecting like heat stroke, maybe like turning into a possible stroke, or I don't know. She put 2 cold packs underneath his armpits, and by the time we got to Baylor Dallas, which was like a 25-minute drive, he was back to normal.
Yeah.
So I didn't know, like, that would be my first like
The big deal
close to a
too
heat
with
stroke.
guys like that is, so number one, get them out of the environment.
Right.
And strip them down. Is
His
because
temp was 101 also.
he was probably getting heat exhaustion getting there, because what happens is their protective equipment they're wearing is real heavy, and it doesn't. The last heat stroke I had was a guy bricklaying, or doing concrete work. Now he's bricklaying, and he's doing insulation work in the attic. So insulation, you don't want that stuff on your skin.
Mm-hmm.
And he's wearing a flannel shirt, long flannel shirt and jeans and all that. So he's dressed for cold, and if it's 110 degrees outside, just go ahead and crank that up to the attic. I don't know if you've ever gone up in your attic for the summer. You're sweating immediately. And he was a new guy, so he didn't know. And I don't know if you see a lot of those workers, whenever they go to the store, like pay attention to the old workers. You know what I'm talking about? The construction crews. Pay attention to the old workers. But you know what? They know what to buy at the store. Right? They'll get Gatorade, water, and like some salty foods because they need to replace electrolytes, right? The young ones are getting energy drinks and shit food and stuff like that, and like the old ones are wearing like long sleeve, but it's like real breathable. You know what I mean? Like a old school, it's a pearl snap shirt. You know, it's real thin. They'll wear something like that. That's the difference between experience and non-experience. But yeah, you gotta worry about the protect. Like football, hey, what happens? That's why we always have the heat strokes and heat exhaustion during 2-a-days, because what are they wearing? Pads and all that other stuff. Literally, I was watching a game, so just so you know what your bad day is gonna be. High heat, high humidity, no wind. That's like the triad for the worst. You're not gonna see it on test. So whenever you play on those turf fields, jack up the temperature an extra 50 degrees. So if it's 104 outside, it's 154 down there on the field. It's just the way it is. So we're watching Little League football, what do you call it? Pee-wee. If they were made for daughters cheering or whatever. I know all the dads coaching, my son's not playing or anything like that. I have no skin in the game. But my wife knows sometimes I get involved when people don't ask me to get involved because I know what the right thing is to do. And she's like, you're going to go down there, aren't you? So it was 104 outside. The humidity was 96 and wind was 3 miles an hour. There was kids puking on the field right before the play. You know what I mean? I see multiple kids puke, and I go, and so their big deal is you gotta be tough. You gotta wear your helmet on the sidelines and all this other shit. And they're heading towards halftime. I went down there and grabbed one of the dads, his assistant coach. I said, hey man, you're fucking up. And he's like, what? He goes, we're giving them pickle pops and giving them all this other stuff. I go, hey, let them take their helmets off on the sideline. I was like, because there was no shade. You know, there's no way to cool these guys. And I go, I know you do your little halftime speech in the end zone. I said, take them under the canopy. And I said, or take them inside, tell the coach to open up the doors and they'll take inside and get some AC. I go, your kids are heading towards heat exhaustion, you might end up having a heat stroke out here. And I go, especially your son who's the quarterback and he's puked twice on the field. And I go, get them water, get them rehydrated, and strip their pads off for halftime. And I said, if they are not playing, strip their helmets off because they can't off-gas. It's like trapping all that heat in, you know. It's like those guys that try to lose weight and they do one of those sweatsuits, you know what I'm talking about? The ones that are like, it's like putting like a baked
Trash
potato,
bags.
trash bags, and they go sit in the sauna or they go run in the middle of the heat. I had another one, FBI guy, he got sent back out into the field and he'd been behind the desk for a little while and he's a little overweight. So he decided all of a sudden to wear one of those suits and go for a jog and do 5 miles, and little did he know he's going to be stripped down on the side of the road in front of everybody in his whitey tighties because we're cutting his shit off. He's in his whitey tighties. We're getting him with fluids and doing all this other stuff. But remember, you can do a modified ice bath for these people. What's the temperature marker I told you to get down to? 102. Again, that's on the pit too. Yeah. You get them down to 102. You can roll up a tarp, roll up something, give them some just ice and water and make a little ice bath.
We have like bags, they're almost like body bags, but they're
Yeah.
blue.
No, a lot of people have started selling those now. But yeah, that's it. Like if it says 2-a-days, like you respond to a high school football field in August and 2-a-days, hey, you know where the story's going? You know what I mean? Cold, I didn't say much, but the big deal for cold and hot is get them out of the environment. Get them to a cooler or hotter environment. I did tell you if it's mild, you can do oral rehydration or oral, you know, heated fluids. But for mild hypothermia, get them out of the environment. If they're severe, the only big deal is you have to be gentle with handling. Because if they're in severe hypothermia and you handle them roughly, you can send them right into BFIT. And ACLS wise, you don't give drugs until you get them up to 92.
Do we have to know active or passive reforming?
It's not active, they'll call it direct, and it'll be passive and direct. So passive is what? Put you in front of a fan. You know what I mean? Like, I'm not putting anything on your skin. Strip clothes and put them in front of put them in a cooler environment. That's passive rewarming. Or passive rewarmer or recooling. Direct is putting the ice bath and the hot packs and the cold packs and stuff like that. The biggest deal with kids, it usually deals with, so all that you can do direct. On the heat and cold emergencies, you can do direct. With kids that have like febrile seizures, they'll say, try to do passive. Because usually they're in their onesies and they're all snugged up and making their fever. Strip them down. Strip them down to a diaper, their underwear, put them under a fan, and stuff like that. Alright. Drowning. I don't know how many drowning questions you get, but if it's a drowning, there is a drowning scenario as one of your scenarios. By the way, remind me at the end of today to share you, I have a picture of all these scenarios we wrote on, the questions we wrote on the board. I'll share you anything I have, alright? We can just airdrop it or whatever. Drowning, there is a drowning scenario, like a 4-year-old. The big deal with drowning in a pool is to make sure to do C-spine, because it could be a diving injury. But I don't know how much drowning questions they're going to ask you outside of that scenario.
There was one that was freshwater versus saltwater.
They still ask that?
Yes.
So, if they ask freshwater, saltwater, by the way, there's no data to back this up. If they ask you which one's worse, it's fresh, because of bacteria. If they ask you what a saltwater drowning looks like, it looks like CHF. But usually it's the freshwater one they'll ask. Now, By the way, there's drownings and there's near drownings. Near drownings means you survive. A drowning means you died. Now they have dry drownings and wet drownings. Wet drownings means you aspirated. There's fluid in the lungs. Dry drowning means you got a laryngospasm and it protected your airway. Like soon, it usually happens in colder water stuff. You get in, kind of like you go into a cold plunge, like that. You get a laryngospasm and you suffocate. There's no fluid going into your lungs. So your airway's protected. Does that make sense? Now, any near drowning or any drowning, period, always transport to the hospital. That's just good for you to know, because if it was a dry drowning and they had laryngospasm, they have to be monitored for like 72 hours because that same scenario can happen again. They could be laying there in bed and just get laryngospasm and suffocate. So that's why they have to be on monitor, because they'll probably have to crack them. You know your altitude sicknesses? Yeah. So I'm going to put them from mild to severe. Altitude sickness. HAPE. And all HAPE stands for is high altitude pulmonary edema.
That's severe?
This is like your mild, moderate, and your severe is HACE, which is high altitude cerebral edema. That's what altitude sickness looks like. I feel like shit. You get fever, usually. Get fever, get a headache. It's your body hasn't acclimated to the altitude. It usually happens to people that don't prepare for it, or they immediately they don't acclimate and they start doing activity as soon as they get up to altitude. Your body has to adjust. So, like, it's happened to my brother-in-law. And they went skiing. They got up there the first night and they had some kind of night skiing event. And this was just at Red River. I think it's only like 8,000 or 10,000 feet elevation. I can't remember how high it is. But anyways, they go to Red River, they have a night skiing event, and he just exhausts himself doing night skiing. They do it all night till like midnight. Wakes up the next day, this is what he looks like. He gets worse throughout the day, he just hurts, his head's pounding, nothing's working. He ends up going to the hospital, ED. They run all kinds of stupid tests on him. I'm like, you live up in the mountains, you work up in the mountains, you not know altitude sickness when you see it. So what do? They do a CT of his head. You know what they check him for? Meningitis. Like, they started throwing all kinds of scary shit at my sister-in-law. He could be meningitis, headache, fever, oh my God. Yeah, it could be meningitis. They did a spinal tap on him. Not joking. I'm like, and she asked me, she's crying, she's running all this test, she's crying, she's like, she's being dramatic. And I said, he's got altitude sickness. She goes, what do we do? And I said, get him down off the fucking mountain. I was like, this skiing's not meant for you this time. So, all the tests were negative. They give him a little fluid, replace for the nausea, vomiting. He gets rehydrated. Guess what? He feels better. He sits there for a day and then he goes, oh, it's time to ski again. He goes, skis, feels like shit again. And they call me this time before they go to the deal. I was like, I'm telling you, come down the fucking mountain. Come home. He comes down off the mountain, he starts feeling better. They get to about the Panhandle, Clarendon. Yeah. He gets to Clarendon and He steps out to go pee on the side of the road. He's like, I gotta pee. And he about passes out. So when they do a spinal tap, they put a cover over it called a blood patch.
Yeah.
Well, his blood patch came off and Rick started leaking a little cerebrospinal fluid. Guess what? He passes out. He gets real hypertensive and all this other stuff. They take him like Clarendon Memorial, where their little shit hospital. Yeah. They take him to some little hospital. And I was like, you know what? Just called us crying again. I was like, just stay there. I was like, we're going. My father-in-law was there at the house. I go, we're going to Clarendon. I said, you're going to take them. I'm going to sit in the hospital one night for him and get down. And I told him how stupid this was. This kid just avoided it. But he's gone skiing again before and after, and you just got to acclimate. But I'm telling you, if it happens, it doesn't get any better. You're done for that time. I know a guy that paid a lot of money to go on the elk hunt. Guess what? He got altitude sickness. He was down for like 3 days. I was like, why didn't you just come down off the mountain? And he just goes, I paid a lot of money for that elk hunt. I go, it's over, dude. I was like, you just sat up there for 3 days and miserable, like that. But here's why you come down off the mountain, because it can get worse. It can lead to high altitude pulmonary edema. What do you think would be the key differential here?
Onset of short circuit.
And what else? Yeah. So what do you think breath sounds are going to give you?
Crackles.
Crackles and rails. So there's your differential. Add this, and then put here. You can go shortness of breath, and crackles and rails. What do you think will make it better?
Get off your mountain.
Get off the fucking mountain. Now, they'll give you steroids, and give you stuff like that. Oxygen. Now, you don't listen to your body now, it gets worse. What do you think happens here? What do you think?
AMS.
Ultra-mental status. Ultra-mental status, and you could get ICP because your brain is swelling. Cerebral edema. So this is what happens to people that go up, what's the big mountain?
Everest?
Mount Everest. Rarely has anybody ever climbed up to Everest. There's like a few people in the world that have done it without oxygen. When they prepare to climb, they go to summit. You know what summit is?
Top. Checkpoint.
No.
It's a checkpoint. So everybody stays at summit for like 3 months. You know why they're doing it?
They get used
They're
to it.
acclimated to it. Anybody's ever done this, this is a long deal. You gotta have some money to do it. But you get there and you get to summit and then you let your body acclimate for 3 months. You don't just go straight to climbing. So they acclimate, it's almost like a little town. If you've ever watched any of these movies, you can see it. Like they're all in tents and sitting there like that, and they all know when their time to go is, and they're all that other stuff. And they're hearing the war stories of people that are dying up on the mountain. When they climb, they take oxygen. They take this stuff called dexamethasone with them. It's a steroid. They also take Lasix. You know why they do it? Because they get up to a certain area, and they're trying to make it to the top. If they get up to this point, and they start getting pulmonary edema, that's where they take the steroid and they take the Lasix. Because what does Lasix do? It helps pull pulmonary edema off of it. Alright? They take the Dex, they take the steroid, they take the oxygen, but usually at that point that's when you realize, hey, this is not meant for you this time. Because what will happen, if it gets worse, they get ultra-mental status and they wander away. They wander away and then they die of hypothermia. So, that is, again, this is not just a Texas test. That's why you get altitude sickness and stuff like that. Alright, let's go to the ocean now. Diving injuries.
Decompression.
Alright, what's the other name for it? Decompression sickness.
The bends.
Say it again.
The bends.
The bends. So decompression sickness or the bends. So this is a gas law deal. I can't remember which gas law it is. I think it's Henry's law or something like that. So when you go down creates more pressure. Or no,
It's greater pressure.
it is greater pressure?
Yeah, you're right. Yeah.
All right, you go down and get greater pressure. What happens is you get nitrogen gets pushed into your tissues. Remember, we're like 70. We breathe in like 79% nitrogen. The nitrogen gas pushes into your tissue. So descend when you descend. When you ascend, when you're coming up, you have to come up and then you have to level out. All right, breathe for a little bit and all that other stuff. And then you come up and then you do it again. You cannot ascend too fast. This injury comes from a fast ascension. When you ascend too fast, the nitrogen comes out from the tissue, and if it pops out too quick, it forms a bubble, big bubble, and it's like a clot. I can't tell you where the signs and symptoms are going to be because it's a clot. It depends on where it lands.
Particularly you don't make it up.
Yeah.
Like, well, that's,
So could the clot go to your brain? Yeah, you could have a stroke. Could the clot go to your lungs? Yeah, you could have pulmonary embolism. You could, it could get caught in the bends of your joints and have joint pain. So it could be joint pain, it could be ultramental status, it could be shortness of breath, all these different things. It could be pain in your knees, pain in your back. Where that clot, that nitrogen bubble forms and goes. But it's the nitrogen reabsorption into the bloodstream is what causes it due to a fast ascension. Alright, now, how do you think that story is going to go? That scenario. Patient just did what? Just like the height one, the altitude one, where are you going to be dealing with the patient at? Probably up on a mountain. This one, you're going to be dealing with a patient that just got done scuba diving. Alright? Number one, how do you treat this patient? High flow oxygen. And you got to get them where?
Chamber.
Hyperbaric chamber. That's the first time I ever said it right. I always say bariatric.
Me too, that's what I said.
It's a hyperbaric chamber. What is a hyperbaric chamber?
so
It's
it's
the
enclosed place
two.
that doesn't have a lot of
Negative pressure.
negative pressure.
Alright, and a lot of oxygen, right?
Yeah.
It'll put you in there for a good while. People actually use it to promote healing. The most hyperbaric chambers we ever had in the beginning, because it was like only 3 hospitals had them, that you could go to the American Airlines arena, and they had like 10 of them. It's for hockey players. They use it because they get a lot of soft tissue injuries. It helps with healing. Back when T.O. was with the Eagles, he had a bad ankle sprain, and they were wondering if he's going to be ready for the Super Bowl. He literally got his hyperbaric chamber from his house. Like you can get portable ones. He gets a portable one and puts it out there, and he does all his interviews from inside his hyperbaric chamber. It was the stupidest thing ever. He's like think of like one of those sauna tents, but it's laid out like a bed, like a coffin. And you get in there and you do hyperbaric treatment, but it promotes healing. But hockey players use them all the time.
Have you seen that movie where they do welding and that guy died but because he was so cold he wasn't technically dead? It's called Last Breath. It's pretty good.
Really?
Yeah.
I know there was a drowning one with some kid. It was like more of an inspirational, those guys that did all the Christian movies.
Oh yeah.
But he was under the ice or something.
And then he was able to climb.
Yeah, but he had the laryngeal spasm. No, laryngeal spasms are the ones that usually
Well, like this
have
one-
the long submersion time, and then
Yeah, well, this one's a true story too. It's just like he like ran out of oxygen and he died, but he technically wasn't dead because he was so cold that they got
the
him back.
metabolism
Yeah.
slows down so much.
Yeah.
That's also another thing about drowning, since the water temp.
You have a better chance of surviving a cold
Cold
water, like real cold water drowning. All right, let's take 10. We're at